Hello, I'm Dr. Dimitrios Kyroudis. I'm the leading doctor for the Pallas Clinic in refractive surgery. This is a company based in Switzerland. I come originally from Greece and I have been employed in Switzerland for the past 5 years. We had access to the SCHWIND platform for more than a decade, and it was always well known that the SCHWIND laser was always coupled with the best diagnostic devices in order to get the right decision making for refractive surgery. And we were actually looked very much forward to the addition of the MS-39 technology. The MS-39 is actually an anterior segment OCT device coupled with topography that can actually present very good data for the whole anterior segment. And it's a well-known fact that the epithelial map is a really early diagnostic predictor when it comes to subclinical cases of four-frosted keratoconus or other patients who shouldn't be candidates for keratorefractive surgery. And having this kind of information through the MS-39 platform would actually improve the way that the doctor can make a good decision making. On top of that, being able to customize the epithelial ablation through the transepithelial treatments according to the pattern for each individual patient will actually prevent any kind of surprises that might be possible for patients with very asymmetric epithelia throughout a hands-free transepithelial treatment in the past. On top of that, being able to assess reliably and predictably the posterior surface of the cornea, regardless of any kind of opacities or other irregularities on the cornea that will make measurements inaccurate with all kinds of previous technologies, is actually giving us very good information on the total optical aspects of the contribution of the cornea to the optical system of the eye. And this will actually allow us to do better customization for people with irregular corneas, people after corneal keratoplasty, keratoconic patients, and patients with other kinds of irregularities that beforehand was not possible through any kind of technology or alternative, because all kinds of measurements were very much unreliable. So nowadays, when it comes to the patient benefit, it's a matter of safety, of doctors having more data available to make the right decisions and prevent high susceptible cases of getting surgery when they shouldn't. And on the other hand, we're very much better in our planning of the treatment, getting more precise data to be really precise with the execution of the treatment. And also, diagnostically, it's very important when you have all the aspects of the optical characteristics of the eye and the whole optical system of the anterior segment of the eye, cornea and lens all together. This is very much important to be able to assess any kind of changes, either for refractive surgery or corneal surgery, and be able to treat that and optimize accordingly.